Here's why treating a adolescent athlete's meniscal tear is not like treating an adult's. Just because your neighbor didn't need surgery doesn't mean that your child won't. The menisci are the shock absorbers of the knee, and they are two C-shaped pads of cartilage that help protect the knee joint. In adolescent athletes, meniscal tears are typically from a pivot or a twist mechanism that happen most commonly in sports like soccer, basketball, or football. And this is much different than meniscal injuries in adults. In adults, most tears are actually degenerative and not traumatic. And as we age, the meniscus becomes less hydrated and less elastic. And this causes the tissue to weaken from decades of microstress. In kids, the meniscus still has a pretty strong blood supply, especially around the outer rim, and so these heal really well after repair. But in adults, the blood supply decreases as we age, so a lot of time these tears are degenerative and they don't respond well to repair. So in younger athletes, we really do try to repair a meniscus whenever possible so that we can preserve that natural cushioning and prevent arthritis in the future. Recovery after repair can take 4 to 6 months, but it's worth it for the long-term health of the knee. In adults, we really try to manage these with physical therapy, but a lot of adults do end up with a partial meniscectomy, and basically that just trims off the damaged part of the cartilage. This does make it feel better quicker in the short term, but does set the joint up for more degenerative changes in the future. And that's why you cannot compare your teenager's injury to your coworker or your neighbor's. That 40-year-old weekend warrior's knee is not the same as your 14-year-old soccer player's knee, and the treatment is very different.